Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Thyroid function is closely linked to reproductive health, and abnormal thyroid hormone levels can contribute to infertility in both men and women. Thyroid hormones regulate various body functions, which include metabolism, energy production, and reproductive processes such as ovulation, menstruation, and sperm production. Thyroid function tests help evaluate whether the thyroid gland is producing hormones at a normal level, which is very critical for diagnosing and managing fertility issues. Let's try to understand some important thyroid function tests for infertility. The first is thyroid stimulating hormone called as TSH test. TSH is a hormone produced by the pituitary gland that regulates the thyroid gland's production of thyroid hormones, which are T3, triiodothyronine, T3, and thyroxine, T4. The TSH test measures the level of TSH in the blood. Abnormal TSH levels can indicate that the thyroid is underactive, which is called as hypothyroidism, or overactive, hyperthyroidism, both of which can affect fertility. Hypothyroidism can lead to irregular ovulation, menstrual irregularities, and an increased risk of miscarriage. Hyperthyroidism can cause menstrual cycle disturbances, low sperm count in men, and difficulties in sustaining a pregnancy. The typical range for TSH is around 0.4 to 4.0 milli international units per liter. But some fertility specialists recommend keeping TSH levels between 1.0 to 2.5 milli international units per liter for optimal fertility, especially during pregnancy. Next is free thyroxine or free T4 test. Free T4 measures the amount of unbound, which is free thyroxine hormone in the blood, and this is the active form of T4. T4 is produced by the thyroid gland and is converted into the more potent T3 in the body's tissue. T4 is critical for regulating metabolism and ensuring proper reproductive function. Low levels of free T4 can indicate hypothyroidism, leading to ovulatory disturbances and reduced chances of conception. Alternatively, elevated levels may suggest hyperthyroidism, which can cause menstrual disturbances and infertility. Free T4 levels typically range between 0.8 to 2.0 nanograms per deciliter. Free triiodothyronine or free T3 test. Free T3 measures the level of unbound or active triiodothyronine, the most active thyroid hormone in regulating metabolism. T3 is produced both by the thyroid and from conversion of T4 into T3 in peripheral tissues. While less commonly tested than TSH and T4, abnormal levels of T3 can indicate thyroid dysfunction affecting fertility. High T3 levels can be seen in hyperthyroidism, which may cause menstrual cycle disturbances and reduced fertility. Low T3 levels can indicate hypothyroidism. Free T3 levels are usually between 2.3 to 4.2 picograms per milliliter. Next is anti-thyroid antibodies test or TPO-AB and TGAB tests. These tests check for the presence of antibodies that attack the thyroid gland. There are two main types of thyroid antibodies which are tested. Thyroid peroxidase antibodies called as TPOAB. These target an enzyme in the thyroid called thyroid peroxidase, which plays a very important role in thyroid hormone production. Then is thyroglobulin antibodies called as TGAB. These attack thyroglobulin, which is a protein in the thyroid gland used to make T3 and T4. Elevated levels of thyroid antibodies suggest autoimmune thyroid diseases such as Hashimoto's thyroiditis or Graves' disease, and autoimmune thyroid disorders can increase the risk of infertility, miscarriage, and pregnancy complications. Even in women with normal TSH levels, the presence of thyroid antibodies can lead to subclinical hypothyroidism and can impair fertility. The normal ranges of TPOAB should be less than 35 international units per milliliter, and TGAB should be less than 20 international units per milliliter. Thyroid binding globulin test is what is next. TBG is a protein that binds to thyroid hormones T3 and T4 and it transports them through the bloodstream. This test measures the amount of TBG in the blood, which indirectly affects the levels of free or active thyroid hormones. TBG levels, if they are abnormal, can indicate that the body's ability to regulate thyroid hormone availability is disrupted. High TBG levels can reduce the amount of T3 and T4, and this mimics hypothyroid symptoms even if total hormone levels are normal. TBG levels can vary, but normally they are between 16 and 34 micrograms per ml. Thyroid dysfunction can lead to preterm birth, preeclampsia, placental abruption, and fetal growth restriction. Ensuring that thyroid levels are well regulated before and during pregnancy is very critical for reducing the risk of these complications. If you wish to know more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.